babies. I hope you're all well. So last week, as you know, we did the birth rehearsal session at Pregnancy Yoga, but some of you couldn't make it, and I know it was a lot to take in for those of you who have still got quite a few weeks left to go before you'll really need to be thinking about birth. So I thought I'd just do a little video here to record some of the breathing techniques, the breathing techniques that we went over in class, and a few of the positions that might be good for if baby gets stuck, anything like that we talked about as well. We also talked about items to pack in a hospital bag, so maybe we can share some things like that on the group with for some ideas. But yeah, when you do your breathing, practice the breathing as much as you can. Daily would be amazing, but every few days is really good. The first breathing technique we went over was our relaxation breathing, which we practice every week in our Shavasana. This is where we breathe in through the nose for the count of 4 and out through the nose for 5, 6, 7, something like that. So this is where we really soften the body, make ourselves feel like a rag doll, softening from top to toe, really progressively relaxing. This is the breathing that you will need during early labour, during those first stages where everything's feeling perhaps a little bit crampy. For those of you that experience it, some may not, some may skip this stage altogether. I did, but if you do experience those sensations, then get yourself into a really relaxed state. And also when you're in active labour, between your surges, you'll also want to go back to your relaxation breathing to really soften the body, relax yourself, and conserve the energy for when those surges start up again. So we don't need to practice that one, we practice that every week. So the next breathing technique that we looked at last week was called balloon breathing. So this is the first super important one for active labour. So at some point your surges will feel like you really need to concentrate on them. The medical staff or the midwife, if you speak to somebody on the phone, may say at this stage a contraction that she can't walk or talk through. So that sounds a little bit scary, but basically it just means that you are needing to focus all of your energy and your breath on the surge to work your way through it, and then when that passes you can then hold a conversation, have a little snack, have some water, all of those things. So it does sound scarier than it is, but that basically means just using all of your energy and your attention, focusing on your breath work to get through the surges. 4 or 5 of these breaths is around the length of one surge, and then when that one's done, it's gone forever. You don't have to see that one again, and you're one step closer to meeting your baby. So I'm going to go over that one with you now a few times. So if you want to make yourselves comfortable on a mat or on a cushion on the floor, you can practice this lying down, practice it on all fours. It's good to practice it in different positions so you know what it would feel like when you're in labour, because obviously when you're in active labour you're not just going to be sitting still, you may be moving around on your ball, you may be bouncing on your ball, you may be on a bed, who knows, you could be anywhere, so it's good to practice it in lots of different positions. All right, so if you want to close your eyes, you're very welcome to, and you're going to bring your hands to your belly again if it feels comfortable. As we breathe in through the nose, we fill the belly like a balloon, hence why it's called balloon breathing. And then as we breathe out through the mouth, a long, slow exhale. Now there's 2 options here. You can either do a counting breath or a visualizing breath. So I'm going to go over both of these now. The counting breath is where we would breathe in to a fast count. So that would look like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, and then out 1, 2, 3, 4, 5, 6. Obviously I wasn't able to breathe properly then because I was counting, but you'll be counting in your head. So if you're counting, you're going to breathe in through the nose, counting fast, breathe out through the mouth, counting slow, 4 or 5 times. If you're doing the visualizing, you may want to visualize as you inhale blowing up a balloon or a hot air balloon perhaps, and then as you exhale, watch that balloon drift off into the distance as the contraction, the surge fades away. All right, so with me now, we're going to do 5 of these breaths and then we'll move on and I'll show you the next one. So when you're ready, take a nice deep breath in, fill the belly, and out. And in, and out. Breathing in and out. Breathing in and out. One more time. And out. And then once your 5 breaths are done, you'd go back to your relaxation breathing, breathing in and out. All right, really softening the body back down again. So that's what you're going to be doing for a big part of your labour, those balloon breaths. Every time you get a surge, you're going to do 4 or 5 of those breaths. However long the surge lasts, it will come to a peak and then you will notice it starting to tail off. I lost my train of thought there. Yeah, so you'll use your balloon breathing a lot. So it's a really, really useful one to practice. Really filling up the belly as much as you can and then emptying it as much as you can. At some point during your surges, that is not going to feel like enough. They're going to start feeling a bit more uncomfortable, a bit more intense. I describe it as a bit toe curling. I remember saying a few choice words and curling my toes, especially in Ralphie's labour, which was the most recent. And at that point, we're then going to use a breath called balloon breath. Sorry, bubble breath. We've just done balloon breath. Bubble breathing. Now this is really similar. So for bubble breathing, we do exactly the same. We breathe into the belly, fill it up like a balloon. But as we breathe out, we make a shape with our lips, which is like a small O shape, as if we are blowing bubbles. And the reason we do this is because the small shape that we make helps to stimulate the vagus nerve, which is in the brain, and this releases oxytocin into the body, which is obviously the birthing hormone, which is going to be amazing. It also makes the out breath even longer and slower, which increases the endorphins in the body and slows the heart rate, slows the nervous system, and makes everything feel a little bit more balanced. All right, so I'm going to show you how to do this now, and we'll do 5 of them together. So I'll show you one, and then I'll show you when we're going to join in. So if you were doing one, you would do a nice deep breath in, and then make a little shape as if you're blowing out bubbles. And you want to keep breathing until you feel like you haven't got much left to blow out. All right, so again, close your eyes or just find yourself a comfortable position. We're going to do 5 of these together, and then I'm going to talk to you about the next part. So when you're ready, take in a nice deep breath in and out. Breathing in and out. Breathing in and out. Breathing in, out. Last one. And then back into that relaxation breath again. At this point, obviously the break between your surges is going to be less than it was before. Probably you're going to be coming very regularly. You may only get sort of 30 seconds or a minute between contractions, and right towards the end it might feel like you haven't really got a gap between them before you then move into transition. Now, transition is a stage which many women find really tricky. This is where the body has lots of physical changes actually that are really useful to be aware of. So at this point you may feel really hot, you may want some cold flannels around, a fan, a water spray, something like that. You may get really cold feet as your body temperature really fluctuates. This could be due to the adrenaline, I'm guessing, surging through the body at this point, and also the exhaustion of going through what you've done up until that point. So you're now at 10 centimeters or ish and ready to start pushing your baby. So you maybe have some like warm socks or something available as well in your hospital bag, or whether you're at home. You may start to say things like, I can't do this, I need an epidural, I really want small pain relief, somebody help me, I've had enough, those sorts of things as you really near the end of completion. And the good thing is that completion is really close, so probably only another 10 surges roughly through transition until you're going to start pushing to meet your baby. So it's really, really close at this point. Very often the midwives can also see baby's head, and that's a really good thing to encourage. So perhaps your birth partner, if they're keen to have a look, then they can see. If they can see baby's head, that might be really reassuring to you that actually you're really close. So to keep going. All right, so we've got relaxation breathing, we've got balloon breathing, we've got bubble breathing. Now, if after transition and you want to start pushing, or you feel the urge to start pushing, if your midwife says stop pushing and just breathe, this is almost like a pant, and we call this feather breath. And the reason we call it feather breath in hypnobirthing is because it's like blowing a feather across your hand. So if you hold your hand out and imagine that you've got a feather in your hand, if at that point you're having to stop the pushing sensation and you just need to breathe, then you can take a nice deep breath in and then blow as if you're trying to move the feather across your hand. So you go and you can see my diaphragm is pulsing at that point, so it's working. The breath is working slowly to help move baby down and to really soften the cervix and get everything ready before you start pushing, because they don't want any, that's really just to avoid tearing or anything unnecessary at that point. So that's a really good tool to use as well. All right, so a couple of things how to move. Obviously you might be in all sorts of different positions. I've always been someone who has preferred to be on all fours in labour. So shaking the maracas like we always do in yoga, where we shake the hips from side to side, is a really good one. Always. We can do some nice big hip circles, so going round as fast or as slow as you like. Lunges are a really good one for opening up the hips and creating as much space as possible for baby to move down into the birth canal. You can do this leaning over your yoga ball if you've got one, which I would hope that you will have, I think, because they're super, super useful. So again, lunges, really great. You can do, what was the other one? If baby gets stuck, that's what I was going to show you. So if at some point you feel like you're ready to push, but baby's not quite in the right position, you can do a couple of things to move baby. So one of those, I'm just going to turn on my side so you can really see. One of those we call shaking the tail feather. So we're going to breathe ourselves in forwards, and then as we come back, we shake baby down and bring our bottom to our heels. So we go breathing in and out. Breathing in and out. All right, So that's if baby gets stuck. And hopefully that will help to shuffle baby around in the birth canal to get them into a good enough position to then be able to descend. You can do a couple of things standing up, which I'll just show you. We can obviously sway, do some hip circles. Anything like this is going to feel nice on the lower back, but also those camel tilts that we practiced before. So where we have slightly bent knees, you can do this perhaps holding onto your birth partner or leaning against a wall. As you breathe in, you're going to stick the bottom back, and breathing out, breathing in and out. All right, so there's just a few ideas for you there. I hope some of that is useful for those of you that weren't there. I know that was a really quick whistle-stop tour, so if anything still doesn't make sense or you need any more help with anything, then please do ask. Either ask me tomorrow night if you've watched this by then, or drop me a message over the next week. And I'm more than happy to go over stuff again, because I know, like I said, there's a lot of information to take in all in one go. But I wanted to make sure that all of you have got those breathing techniques, because if you learn nothing else from pregnancy yoga, take the breathing. It's the one thing that has got me through all of the labours that I've been in so far, and I learned it at pregnancy yoga the very first time around. So I would say definitely practice those as much as you can, whether you've got 3 weeks to go, 2 weeks to go, or 10 weeks to go. I would practice those as often as you can. All right, I hope you're all okay. I'm looking forward to seeing you all tomorrow evening, and yeah, get breathing.